Well, good morning. Nagendra Rana here. The topic of the day is expansion of insurance coverage under Ayushman Bharat. Expansion of insurance coverage under Ayushman Bharat. The expert committee of Niti Aayog will discuss recommendations for revising Ayushman Bharat package rates and also explore a possible increase in insurance coverage beyond rupees 5 lakh limit. There are nearly 1,949 medical procedures that are covered in the scheme, and rates of these are fixed for treatments at empaneled hospitals that include both state-owned and private ones. So India's flagship Universal Health Assurance Scheme, Ayushman Bharat, provides coverage to 12.5 crore families, each with a floating insurance coverage of rupees 5 lakh. So in case the family has geriatric members, then the additional rupees 5 lakh is added to it. About 33 states, excluding West Bengal and Delhi, are part of the scheme. The Odisha state government has begun discussions to come on board and be part of the scheme, and technicalities like software integration are currently under discussions. Incidentally, several state governments and hospitals have requested a revision of let down packager costs and medical procedure charges considering inflation and other factors. So this prompted the Union Health Ministry in March this year to set up a 16-member expert committee. So this 16-member committee will monitor the progress of Ayushman Bharat PMJAY, focusing on beneficiary identification, hospitalization and modes implementation. A key task of the committee is to suggest measures to prevent fraud or misuse of the scheme. So additionally, the committee will explore ways to provide linkage with Ayushman Bharat Digital Mission, that is ABDM, Ayushman Bharat Digital Mission, and Ayushman Arogya Mandirs. So the committee recommendations will also address whether package rate revisions are necessary, what sort of revision are acceptable, and so on. Also under discussions or scope of work of the committee is to see if the medical coverage needs to go up beyond rupees 5 lakh or not. So the Ayushman Bharat scheme, which completed 6 years, includes the health benefit package, defines the scope of healthcare services and the financial risk protection for beneficiaries. The HBP, that is health benefit package, is designed to cover diseases that are prevalent or contribute to the highest out-of-pocket expenditure. The health ministry is already working to increase the number of geriatric care packages available under the scheme. Geriatric care is a medical specialty that focuses on the unique health needs of older adults. So the ministry has formed an expert committee and suggestions have been sought for increasing the number of geriatric care packages under the health insurance scheme. At present, there are 25 odd such packages included in Ayushman Bharat. So work is on to increase the number of care packages, especially targeting the geriatric population. Adding the recommendations on new packages additions could happen in another month or two. The pilot project to onboard the septuagenarian population under the revised guidelines of the scheme is underway, and registering these beneficiaries is likely over the next few weeks. So the scheme to include those aged above 70 years and above will be formally launched soon. So the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana might soon include coverage for the treatment of Alzheimer's, dementia, heart failure, and other diseases that primarily impact the elderly. Because PMJY offers approximately 25 health packages that meet the needs of the elderly. The National Health Authority, which is the implementing agency for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, is working towards adding more packages that exclusively tend to geriatric care or old age related ailments, as the number of such beneficiaries is likely to go up significantly, with the government expanding the schemes to include senior citizens aged 70 and above, irrespective of their income group. So a committee headed by medical experts reviews health packages under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana regularly. There is a special case through as focuses on one large subgroup that has been included in the scheme. Well, the committee will work towards identifying health issues affecting the seniors, especially those requiring hospitalization, and try to develop packages so that they can get timely treatment. So the expansion of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to include senior citizens will potentially benefit around 6 crore individuals across 4.5 crore families. The elderly are often affected by common health issues such as stroke, heart failure, cancer, Alzheimer's, and dementia. They are planning a special package to address the treatment of these ailments and their associated complications. So the world's largest publicly funded health insurance scheme, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana it was introduced in 2018 to offer an annual health cover of Rs 5 lakh per family for secondary and tertiary care hospitalization to 55 crore individuals from 12.3 crore poor and vulnerable families. The funding for the scheme is shared by the center and the state in 60-40 ratio. So as per the National Health Authority website, all expenses related to the treatment such as pre and post hospitalization costs are included in a package. The specified surgical packages are paid as bundled care, where a single all-inclusive payment is made to the EHCP by the insurer or SHA. So medical packages are paid to the EHCP based on a per day rate depending on the admission unit, that is general ward, HDU, ICU, with certain predetermined add-ons paid separately. Daycare packages follow a payment structure similar to surgical packages. The treatment packages cover a wide range of treatments across nearly 24 specialties, including specialized care such as oncology, neurosurgery, and cardiothoracic and cardiovascular surgery. So the package rate in case of surgical or defined daycare benefit includes, as per National Health Authority website, this is registration charges, bed charges, nursing and boarding charges, surgeons, anesthetist, medical practitioner consultant fees, anesthesia, blood transformation, oxygen, OT charges, pre and post hospitalization expenses incurred for consultation, diagnostic tests and medications before the admission of the patient in the same hospital, and up to 15 days of the discharge from the hospital for the same ailment surgery. Any other expenses related to the treatment of the patient in the EHCP. So hospitals can be paid a higher amount for such surgical conditions that are not listed in the package list, and EHCP will need to take approval and fix the rate from the insurer or SHA before providing the treatment up to the limit of rupees 1 lakh. Ayushman Bharat advantages would be available to all senior citizens who are 70 years of age or older, regardless of their socio-economic status, as the government has approved health insurance coverage under the flagship initiative Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So the Union Cabinet approved a significant expansion of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The move extends health coverage to all senior citizens aged 70 and above, regardless of income, bringing critical health care access to approximately 6 crore senior citizens and benefiting 4.5 crore families. So under the expansion, senior citizens will receive free health insurance coverage of up to rupees 5 lakh per family annually. Those already enrolled in Ayushman Bharat Pradhan Mantri Jan Arogya Yojana will also gain an additional rupees 5 lakh top up exclusively for members aged 70 and above. Notably, a new distinct card will be issued to eligible senior citizens, enabling easy access to these benefits. Families not previously covered under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana will receive the same coverage on a family basis. So additionally, senior citizens enrolled in other public healthcare schemes such as the central government health scheme, ex-servicemen contributory health schemes, or Ayushman Central Armed Police Forces can choose to either retain their current coverage or switch to Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So launched in 2018, Ayushman Bharat aims to provide universal health coverage, particularly to vulnerable populations. As of September 2024, 35.4 crore Ayushman cards have been issued across India, covering over 12 crore families. The scheme operates in 33 states and union territories, providing health insurance of up to rupees 5 lakh per family for tertiary care. So in a significant move, the Union Cabinet approved a major expansion of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana on September 11, 2024. Under this decision, all senior citizens aged 70 and above will receive health coverage regardless of their income. So the expansion is set to benefit around 4.5 crore families, including 6 crore senior citizens, by providing them free health insurance coverage of up to rupees 5 lakh per family. With this approval, every senior citizen in this age group will have access to the scheme's benefits regardless of their socio-economic status. So the new distinct card will be given to the eligible senior citizens above 70 years. They will receive a new distinct card under the ABPMJY scheme. Then senior citizens within families already covered by Ayushman Bharat Pradhan Mantri Jan Arogya Yojana will receive an additional top-up cover of rupees 5 lakh per year. This top-up will be for them and they will not have to share it with other family members under the age of 70. Then family coverage, senior citizens who are not part of an existing Ayushman Bharat PMJY family coverage will be provided with a cover of up to rupees 5 lakh per year on a family basis. Then senior citizens who are already benefiting from other public health insurance schemes like the central government health scheme that is called CGHS, ex-serviceman contributory health scheme that is called ECHS, or Ayushman Central Armed Police Force that is called CAPF, have the option to either continue with their current scheme or opt for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Then the senior citizens who are covered by private health insurance policies or the employees' state insurance schemes are also eligible to benefit from Ayushman Bharat PMJY. Launched in 2018, Ayushman Bharat is a landmark health initiative designed to provide universal health coverage, particularly for rural and vulnerable populations. The mission aims to implement transformative interventions that address health needs comprehensively across primary, secondary, and tertiary levels. So the Ayushman Bharat is designed to implement transformative interventions that address the entire spectrum of healthcare across primary, secondary, and tertiary levels. It follows a continuum of care approach and consists of two interrelated components. These are Ayushman Arogya Mandir. The first component of Ayushman Bharat involves establishing Ayushman Arogya Mandir, previously known as the Health and Wellness Center. These Ayushman Arogya Mandirs offers a broad spectrum of healthcare services including preventive, promotive, rehabilitative, and curative care. So these centers are being created by upgrading existing sub-health centers, SSCs, and rural and urban primary health centers, that is called PHCs, to enhance accessibility to healthcare in rural and urban areas. The goal is to bring healthcare services closer to communities by offering comprehensive primary health care, that is called CPHC. So as of September 12, 2024, there are 1,74,453 Ayushman Arogya Mandir across the country. These include 1,12,617 sub-health centers, 23,903 primary health centers, 5,123 urban primary health centers, 5,632 urban health and wellness centers, and 12,178 Ayush related centers. And the second one is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is the world's largest publicly funded health insurance scheme. It provides health coverage of up to ₹5 lakh per family per year for secondary and tertiary care hospitalization. So as of September 9, 2024, over 35.4 crore Ayushman cards have been issued under the Ayushman Bharat PMJY across the country. The scheme is currently operational in 33 states and union territories except the NCT of Delhi, West Bengal, and Odisha. So the healthcare scheme has authorized a total of 7.79 crore hospital admissions amounting to rupees 1,07,125 crores in financial coverage till September 9. So Ayushman Bharat PMJY scheme has been witnessing tremendous growth in its beneficiary base, initially covering 10.74 crore poor and vulnerable families. The Government of India expanded this coverage in January 2022 to include 12 crore families, reflecting India's 11.7% population growth since 2011. In addition, the scheme was further extended to include 37 lakh accredited social health activists, Anganwadi workers, and Anganwadi helpers and their families, providing them with the free healthcare benefits. After the recent cabinet decision, Ayushman Bharat PMJY is set to offer free healthcare coverage of ₹5 lakh to all citizens aged 70 and above across the country. Thank you very much.